tell my patients I can't do surgery by myself. So I, by nature, need another pair of hands to help. And that certainly is not going to be the circulating nurse or the scrub nurse, but a surgical assistant.
Most people do not know what a surgical assistant is.
It's very important to have a rapport with the surgeon. They depend on our knowledge to help them to perform the surgery.
The surgical assistant is the extension of the doctor's right arm. We are the second in command at that table.
This is all they do. They are trained, they've got very good knowledge of the anatomy. They spend much more time in the OR than anybody else. Let's face it, they're in the OR 8 hours a day, 5 days a week, and frequently more. So they're seeing much more than any one resident could see. They certainly have been in the OR more than I have. So their ability to take that knowledge from other cases, bring it into my OR, as well as just their comfort with closing skin, exposing tissues, that's a very difficult skill to learn, and that's what they're trained to do.
We get to go through every single specialty. We do neurosurgery, vascular surgery, plastic surgery, orthosurgery, OBGYN, and general. We do everything. So every dynamic, depending on the room, is different.
Years back, probably in the 70s and 80s, there were always 2 surgeons involved in the room with the patient. Financially now, in the medical arena, in the surgical arena, it's not really viable to have 2 surgeons.
From an administrator's perspective, the surgical assistant is really an integral part. And I keep using the word team because that's really what it's all about.
Teamwork is something that we definitely try to get across to the surgical assistants. And we are really working hard at Eastern Virginia Medical School to ensure that our medical students are working in teams with the surgical assistants from early training periods.
Anytime you're doing an operation, you need multiple people looking at the same thing. I consider surgical assistants an integral part of the team. If they see something they're uncomfortable with, if they see bleeding that I don't see, if they think something else should be done, they need to speak up, and I anticipate that.
Teamwork in the OR is the center of the OR.
A surgical assistant at the field or in the OR really acts as a liaison between the surgeon and the team, which consists of anesthesia, the OR nurse, and the surgical tech, and acts as a liaison between the team and the patient.
Preoperatively, I'll get with the nurse and I'll go over the patient's chart with her. Does the patient have any allergies? Do they recently receive any medications we need to be concerned about, or do they need blood products? Is there anything I can help her do to get paperwork and make sure the patient's going to be in the best care possible?
The number one is being a patient advocate. Always the patient is number one.
Having a surgical assistant in the room is having another trained set of eyes on a case.
They are very helpful in terms of getting the room set up. They assist in bringing the patient into the room, positioning the patient, making sure there's appropriate padding. And then when the case is done, they're also helpful in terms of cleaning the patient off, getting dressings on, and transporting the patient onto the bed, which certainly makes the turnover time much more efficient and makes my cases go smoother.
Before the surgeries, pre-op, we position patients, we get everything ready, we help open up all the supplies that are needed.
A surgical technologist, in my opinion, has a lot of expertise about all the instruments, and again, needs to very much know the steps in the operation that we're going to do and almost anticipate what instrumentation they're going to need to hand me. They generally will know what type of suture I'll need. The surgical assistant, on the other hand, is more of the actual assistant during the operation, so anticipating the moves I'm going to make and kind of moving together as a team.
In the OR, the tech would pass all the instruments to the doctors and the surgical assistants if they need additional instruments. The surgical assistants, what they do that the techs don't do is they primarily, they can place the retractors, they close up all the rooms for the doctor.
The great part about them is that they're usually very excellent in suturing, which is one of the big roles that they have when they work with me, as well as anticipating how the case is going to go, particularly if it's a case they've done a lot with.
We've seen a shift over the last 20 years of my teaching medical professionals, and that's a growth in the surgical assistant programs.
The hands-on training for the surgical assistant, even in the didactic portion of the program, consists of many different skills that we're allowed to perform in the OR.
Surgical assistant, we have to learn anatomy, physiology, pathophysiology, microbiology, and surgical assistants, like surgical technologists, also have to learn some of the instrumentation involved in each of the types of surgery.
The other value to me as an administrator is it really maximizes the inflow of patients to my surgical suite.
The best case scenario for me is for me to be doing the operation with a skilled surgical assistant. If I've got even a chief resident in the room, they can't assist me like a surgical assistant.
Short term, you obviously can reduce your cost per case by forcing a physician to bring a partner in to help them with the surgery. Long term, it really reduces your patient inflow, because what a surgical assistant does is it allows one surgeon in a practice to be very busy in an OR, and it allows his partner to be very busy in his office. Because if you can keep the partner busy in the office, they're seeing more patients that'll eventually come to your operating room.
I help do surgery. I make surgery go better.
Their expertise is essential. The ability for them to help me do an operation safely is essential, and I can't operate without one.
Surgical assistants play a vital role in the operating room. They're a trained second set of hands required for many procedures, helping the physician reach peak performance. They make operating rooms safer and more efficient and improve the patient experience, working in both pre- and post-op. And they're certified professionals, rigorously educated and trained. For more information, visit American Surgical Professionals online at amerisurg.com or call 713-779-9800.